413 hospitalized patients is a record. The previous record was 399 in December of 2020. So this is our first time over 400. That does include all ages. That includes all hospitals. So it includes the U of L system, Baptist system, and Norton Healthcare system. Your second question, there's a lot of talk out there about admitted for COVID versus admitted with COVID. And we kind of have three categories here. So you can have a COVID admission, which is the run of the mill, like I have COVID, I'm short of breath, and I need treatment for this virus. Then we have a second category, that's a direct COVID admission. So the second category I would call an indirect COVID admission, and that's people who have chronic conditions that are exacerbated or destabilized by their having the COVID infection. So maybe somebody with type 1 diabetes who winds up with diabetic ketoacidosis or uncontrolled diabetes because of the presence of their infection. So they're not being necessarily admitted for respiratory COVID symptoms, but they're being admitted for something that they would not have had in the absence of the virus. And then we do have those incidental COVID admissions. So that's your young guy who's had a motorcycle accident, admitted for unrelated trauma, and finds out incidentally on screening tests that they have COVID. The hospitals will have to give you the numbers for those. They are screening admits, so there certainly are going to be a number of those admitted with COVID versus admitted for COVID. And I'll ask Dr. Burns to comment on what he's seeing in the hospital. But my belief is that the significant majority of those inpatients with COVID are either admitted directly for COVID or indirectly for an exacerbated condition that they already have.
And that is exactly correct. We're seeing the same things at the hospitals that I cover as well. You know, you have people that are admitted directly for COVID. That is, those people who their oxygen saturations are low. They are having problems breathing. They may be obtunded. They have other symptoms that make them dangerously low oxygen levels, such that they need immediate and emergent medical care. And we also have people who are being admitted for appendicitis, people who are being admitted for cholangitis, gallbladder attacks, people that come in with maybe diabetic foot ulcers, and on screening they are COVID positive. And so the question is, what to do about them. But those people are those folks are being admitted too. So we're seeing the whole spectrum as well, admitted for COVID, and as you said, admitted with COVID.